I'm a professor at the University of Essex and the director of the East of England Research Design Service. And I'm really here just for a very brief purpose to welcome you all, to thank Darren and Emily, who've done all the hard work of making this event happen. Thank you to you, Darren and Emily, and I'll hand over to you for other logistics. I will just note that we are recording the session and the recording has started. So for those of you who aren't aware, there are 10 research design service teams across the country, and we absolutely look forward to hearing from applicants to support you in your journey, and hopefully this seminar will help you too. I'm also very grateful to the faculty from NIHR Mothership, let's say, for Ben and Rifat. I can see her on the screen, and thank you to all of the people who've made yourself available to speak this morning. I've got one commercial, as it were, advert that I think will be of great interest to you. The grant writing retreat that we have produced a little video about I've put the YouTube connection into the chat box, and the application information is actually on the Research Design Service Northwest groups page. As I say, although there are 10 different groups, we work together very closely, and this national retreat was a terrific success last spring, and we're really looking forward to gathering people in the coming spring to give you focused time to work on your application under really close guidance. So a very competitive event. Oh, there's a nice poster slide of it. As I say, the link is open for applications, and there's detailed guidance available on the web page. So with that said, I think they were the main things I wanted to say this morning. I myself am proud to be running a RfSC research study at the moment in social work. It's a great scheme, and I really wish everybody here great success in your plans to apply for it. So I'll hand back to you, Darren, with thanks again for all of your support, Darren and Emily.
Thanks, Andrew. So before we start, just a little bit of housekeeping. Just please keep your microphones on mute unless it's in one of the Q&A sessions and you want to ask a question. As Andrew said, the session will be recorded and the recording will be made available. So if people haven't been able to attend, it can be passed on. Although there's 2 designated question and answer slots in this event, we think it works best if people directly type their questions into the chat function. They can be answered by the NIHR team, or if we don't get to them directly, we can cover them in the question and answer session. We have a 5-minute comfort break timetabled into that will start at 11:20. So I won't talk anymore. I will pass you on to the Research for Social Care team, who will tell us more about the call. I believe we're starting with Ben Morgan, the Assistant Director. Over to you, Ben.
Thanks, Darren, and thank you everybody for turning up today. I think the slides are being shared centrally, so if we can get the slides, great, thank you.
Apologies, 1 second. Just having some technical difficulties with Zoom.
I do have them. I can share if needed. While we're finding the slides, just say I'm Ben Morgan. I'm the Assistant Director for the Research for Social Care call, and I'm going to cover the beginning about what RfSC is. So can we have the next slide? Because we've got a few other speakers after me. We've got to hear from me about the RfSC call and call 6, and then we're going to hear from the chair of RfSC, Chris Hatton, to talk about his reflections. We're also going to hear from Francis, who's a public member, on RfSC committee to talk about his observations. And then we're also going to hear from Phoebe, who will talk about EDI, and obviously important to get EDI correct in the application process. So let's start with some RfSC information. RfSC is looking to fund social care research that will improve practice ultimately, to expand, strengthen, and improve the way that social care is delivered for care users and the wider public. It also funds social care in adults as well as children. I'll talk a bit more about that later, because we've not done that until recently. It's mainly been focused on adults. It's relatively new. It started off as a pilot in another program, the Research for Patient Benefit Program, RFPB. You can probably tell the name's a link there. And we did it as a pilot, and it went well, so we continued it. And between 2019 and earlier this year, it was an annual call for £3 million per call, and each project was up to £350,000. And it operated like many other programs, two-stage assessment process. But one key difference, I think one of the reasons it worked quite well, is it's a national panel of social care experts. So one thing you can be reassured about is if you apply to RfSC, you'll be assessed by your peers. It's not a health panel with a couple of social care experts. They are social care experts throughout, including academics, practitioners, social workers, public members, etc. So you'll get a fair review by your peers, and I think that's one of the reasons it's worked quite well. Moving on. RfSC has recently increased in size. It's doubled in size, actually, and this is part of the wider NIHR commitment to fund more social care research. So hopefully you'll be aware NIHR changed its name in April to National Institute for Health and Care Research to reflect that. And there's other parts of the system which are doing more social care research, but RfSC in particular, we've doubled up. So we're 2 calls a year now, £6 million across those 2 calls. And another big change was we included children's social care. As I mentioned, we had only focused on adults, and that's mainly because Department of Health and Social Care has the responsibility for adult social care. But we are now open for children. So all future calls, all current calls are open. If you're working in children's or young people's social care, that's absolutely fine. You can come to us and you'll be in scope, typically, obviously ensuring the research is in scope, but the topic will be. Next slide, please. Here's just some figures. Said relatively new, so we've only got 4 or 5 calls on the go at the moment. We received quite a few applications. It's quite pleasing to see so many. We wasn't sure in the early days how many we would get, if there was many people looking for this type of funding, but there clearly was. And just other thing to draw your attention to, I think, is quite interesting here, that the success rates are pretty good for this. When you get to stage 1, you've got just under 1 in 2 chance of getting through to stage 2. And if you get to stage 2, you've got well over 1 in 2 chance of being funded. The success rate at stage 2 is 64%. I think overall that's about a 30% success rate, which is pretty good, as most research funders are usually in sort of the high teens, low 20s. So I think RfSC is an accessible program. And we're keen to support a wide mix of studies. So I think that's a positive thing about the call. And you can see each call, we fund about 10 or so studies, excuse me. Apologies. We fund around 10 or so projects per call, and we've got a portfolio of about 44 projects at the moment. These figures here are our regular calls, our business as usual calls, our open calls, but we do some other calls as well. If you move to the next slide, please. We do some more priority and focus calls. So in addition to those 2 calls I mentioned running every year, we may issue a 3rd or a 4th. And ones we've done recently are a mental health call in the north. That was with the sort of the bigger RFPB parent program. And then we've done some additional work on mental health and dementia, which was just an RfSC call. And then more recently, we've done some add-on funding on EDI. We'll hear more about EDI later, but we offered funding for our current funded teams to do some expansion on the EDI work, and it seemed to be quite successful. So we do other things on top of the 2 calls that we routinely run. And this is just an idea of some of the topics. We don't specify it, simply it's social care. We don't say this part of social care or that part of social care. It's up to yourselves as the research team to justify what you're doing and explain the benefit your project will be. And here's just a range of studies we've got, some in learning disabilities, addiction, workforce, dementia, and a whole range of other stuff as well. All of the projects are on the NIHR website. If you want to see exactly what we funded, you can just see if you're doing similar work or not. But generally, as long as there's a trajectory to benefit in social care, and you can make that case, you got a reasonable chance of being certainly eligible and in remit for RfSC. Moving on, please. So call 6. So this is the call that we have open now. It opened September. It closes in stage 1, closes in January. So if you are looking to apply to that one, bear that in mind. This is the open call, but we're also a part of a wider NIHR theme call on MND, motor neuron disease. So sometimes there's a themed call as part of our regular calls, but if you're doing something on MND, fine, come into this. If you're not, it doesn't matter. They're all reviewed in the same way, so you don't have to be doing that particular highlight notice. You can do anything in social care, and those are the subsequent dates. So if you do apply and you get through and you're ultimately funded, you'll hear from us probably July, August next year. And these dates are fairly consistent. So there's another call 6 months after that will follow a similar time frame. So there's a rhythm to the 2 RfSC calls. So you can probably guess and predict what they will be in the future if you desperately want to see what the call 7, 8, 9, etc. might look like. Next slide, please. And some other things we do. So obviously our main job is to fund research. We provide funding to applicants who apply and are successful. But we do a bit more around just that part of what we do, and just to try to support researchers. So the first thing to mention is we have a pre-submission form, which is completely voluntary. You don't have to use it. But if you would like a comment from the RFS team on whether you're likely to be in scope, you will get some comments. So if you're not sure, you can speak to us. I mean, you can call us up or phone us up, email us anyway, but the pre-submission forms are a more formal route to get some commentary from us. So if you're not sure, that's a really good thing to do. We hold events like this with the RDS and other colleagues across the NIHR grant writing retreat. We support that as well. RDS, great use, great resource. Use the RDS. They will help you. They will make your application stronger and more competitive. So do speak to them if you're considering applying. Something we do in the RfSC team is those applications which are invited to stage 2, successful stage 1 applicants. We invite them for a workshop on strengthening their impact, and that's generally been well received. And nearly, well, I think all the researchers come to it to make sure their stage 2 application can be as competitive as possible. Another thing we do is we're trying to create a community and a cohort of the people we fund. So every year, the 10 or so people that are funded, we invite them for a meeting to network, to introduce them to Department of Health and Social Care policy and liaison officers to try and work with, get those relationships established now. We invite speakers from practice, from other social care bodies to try and make sure we're maximising what we're funding. It's not just a collection of random projects. We can try and see where there's synergies or linkages and try and make the most out of what we're funding. We also think we've got a responsibility for capacity building in its entirety. So not just building capacity at the researcher level, we take part in what's called an early career researcher reviewer scheme. So if you've never peer reviewed, if you've never done anything like that before, you can join the scheme and you can do like a shadow review and get some experience of reviewing applications. It's quite a good thing if you've not done that before. And then we also try and engage with the sector and more widely. So we've done we did a joint call with a charity last year, which was quite successful, we think. And again, we're open to those proposals again. So if you know charity or third sector colleagues and they're looking to do funding in social care, we're happy to speak to them because we want to work with them. And that was my final slide. So I will pass over to Chris now. Thank you.
Thanks very much, Ben. I'm the interim chair of RfSC, and I've just got a few observations which kind of repeat mainly what Ben's already said, and will chime with what people after me are going to say. Could I have the next slide, please? So really, I guess my overall observation is that RfSC has already been a great success as a scheme, and part of that is that we really try and welcome applicants. We try and encourage applicants to apply, and we try and provide feedback, I guess, to maximize the success. In terms of the applications themselves, there are things that I think we expect as a committee and as a panel for all applications to RfSC. One is that applications are expected to have a high degree of involvement from relevant people who are drawing on social care and from social care practitioners throughout the research project. So that might be at the stage of putting the proposal together, through to conducting the research, through to working out how to share those findings and maximize their chances of having an impact. It's really good to see in applications those that have strong links and collaborations with relevant people with social care needs. So it's people who draw on social care, carers, maybe family carers, and also social care provider organizations too. Those strong links and collaborations, I guess, encourage us to have confidence that the research can be feasible and can be practically done, and that there's a potential route to that research having an impact in the real world. We're looking to demonstrate potential benefit to people using social care, family members, and relevance to social care, and potential impact on social care too. This isn't always a kind of linear process, and it depends a bit on how much money you're applying for. I guess the distance from the particular piece of research through to eventual potential impact or benefit for people using social care. So that might not always be kind of a guaranteed or potentially guaranteed kind of benefit, you know, within a very short time after the project. But what we do want to see is a very clear pathway from the research you're proposing to what might come next to end up in benefit. And we also expect to see, and this is a really important feature of the committee's evaluation of applications, we really expect to see an embedded and thorough EDI strategy that is appropriate to the project. So, for example, if you say that you're going to recruit people from minoritized ethnic communities, we would want to see some kind of plan about exactly how you're going to do that, rather than just making that sort of general statement. Can I have the next slide, please? And really, I think RfSC, we really want to encourage diversity. So we welcome the whole spectrum of research methods. These might be from creative and participatory methods, through to secondary data analysis, through to randomized controlled trials, if you can fit it within the funding envelope, and everything in between. So we have a very wide range of panel members with different methodological expertise. So we would hope that no matter what you're submitting, that there should be people who can appreciate the research methods on their own terms. As Ben's already mentioned, the remit of RSC has been extended to include children's social care as well as adult social care, and we've expanded the panel accordingly. So we're really looking forward to seeing more applications relating to children and young people and social care. And I think this really kind of fills an important gap that was there previously. One thing I want to highlight is that we really want to encourage earlier career researchers. So people who are earlier in their research career, you know, no matter where they are in their other careers or other aspects of their lives. And we really welcome those sort of earlier research career principal investigators. I guess what we're looking for in those applications is that the principal investigator has good support within the project team, perhaps from more experienced people. But we're absolutely looking for the principal investigators of the future to come to RfSC. And one final point, I think we quite often see, I think, applicants feeling that to be value for money, RfSC applications have to be kind of over-ambitious and stuffed with lots and lots of different work packages, which as a committee we look at and worry about whether they can actually be done at all and within the time and resources that are being asked for. So we're really keen to recognise that research proposals, research applications should be feasible within the resources available. So we're not looking, we're looking to fund research projects fairly. So don't feel you have to kind of overstuff your applications with things that means that it ends up not being done. And occasionally we will sometimes say, this is too much, but we really like aspects of it. So come back to us with something with, that's going to be more feasible for you to actually do. Okay, the next slide, please. I think overall, as Ben has already said, I think it's a really exciting time to be involved in social care research when it comes to NIHR. Over the past number of years, really, I've seen NIHR demonstrating a serious and sustained commitment to funding, supporting and helping to grow the infrastructure for social care research. That is already happening and it will continue to happen into the future too. Both, the way that RfSC has developed and expanded, and also there are lots of other developments across NIHR funding programs, across pretty much the whole range of funding programs now are beginning to think much more about social care research and how they can encourage and support social care research. So for me, and I think the capacity building element that Ben mentioned is really important here. I think now is an excellent time to be building a sustainable and fulfilling social care research career. And I really hope that RfSC and the RfSC program is seen as an important component of that for people wanting to be involved in social care research. So that's all I've got. I'll hand on to Francis now.
Hi, can you hear me? Okay, I've got a thumbs up there. I'll take that as a starting point for my presentation. If I can, yeah, thank you. On to the next slide. Thank you. So, as I said, thank you for inviting us along here today. I thought it'd be helpful just to provide a bit of context about public members. I don't propose to talk through the responsibilities that are listed on this slide, as I think they sort of speak for themselves. I simply put them here just to state the obvious, that public members are full members of the committee, and just like all the members, we're expected to actively contribute in the whole process. Sorry. The second part of this slide sets out the skills and experience we're expected to have as public members to be recruited into our role on the committee. My personal background is as a civil servant. I was in the public sector for nearly 2 decades, worked on issues including public engagement. In the last 5 years or so, I've become a full-time carer for my wife, who has a long-term condition. And I also have caring responsibilities for my brother too, and I'm a trustee of my local health watch. So that's my sort of background. My observations on other PPI members as a whole is that we all have a distinct and diverse set of valuable skills and experiences, a bit like Chris was mentioning amongst the panel as a whole. And we bring a different set of understandings that sort of helpfully bring different perspectives from each of us as public members to the table. So if we move on to the next slide. So in terms of our role, it's, it says here 3 to 5 applications that we look at each stage. This is usually about 4 that I will sort of look in depth at a meeting, and between all of the public members on the committee, we make sure all the applications are looked at in depth by at least one of us to provide a public member perspective to the proceedings. The next point is about participating in the evaluation of all applications. I think it is important to say, although we have ones that we dive into depth on, we will have a look at them all. And while not leading discussions on those, on all of them, you usually find that looking through all of the applications that, apart from the ones I'm looking at in depth, there will be a number of issues that come out in others that I will sort of look to clarify or bring up at a meeting. In particular, the role asks us to focus on the plain English summary and the patient and public involvement side of things, which I'll call PPI from here on. And also, you know, we are invited to touch on other issues that we see as notable in applications. And there's a few sort of themes that have come out through looking at applications that I'll return to in a minute. So next slide. I think I really wanted to sort of focus on some of the practicalities of how we look at the applications and things that come out for us. So my first point here is around the plain English before and after the summary. So I think it's worth noting that the plain English summary is not the first thing I'll look at or we will look at in an application. Before we get to that part of the application, we already have the key information on the title of the research project and who is taking part in it to look at, first of all. If I could touch on one small point here that I reflect on is it's just to be as clear as possible in the title of the project. That might sound obvious, but sometimes it can feel, this isn't just looking at applications here, but elsewhere, and other work is, you know, it can feel like a snappy title or an acronym can help with a project. I just suggest avoiding those, making them as clear and direct as possible in the title. I think my other point here on plain English before and after the summary is just to is pretty simple. We'll be reading through the whole of the document in detail, and the clearer it is throughout, the better it is for us all as public members and all of the panel. The second point here on following is about following the advice. The NIHR page on plain English summaries really is excellent, and you know, please do read it, especially the section on how to write a summary. You can find the advice by simply googling NIHR and plain English summary. It can feel that once in a while that the applicants have not taken all that advice into account, and I can say I'd say it's quite noticeable if that's the case. From the guidance, I particularly draw attention to the subheadings. It sets out that you might use, although they're just for guidance. I do find that they are a very good starting point for structuring the whole of the plain English summary section. The two other points I'd make on what to summarize. Please do make sure all the key points of the application are summarized. We do read through all of the application, and if we find that there are things in the whole of the application that don't sort of fully relate to the summary, it can feel quite jarring. So just for the help of the flow of the reading. And then sort of finally on this part on the plain English summary, just getting a fresh look. You know, it would be it's very good practice to invite patients, carers, and members of the public in developing the plain English summary. It's mentioned in the guidance. I just wanted to draw it out. It's very noticeable and very helpful for us when it has been done. You can sort of see it in how the document's structured. So key aspects of public involvement in the application. I just want to sort of draw out a few points here that I particularly focus on. The core members of the team will not only be looking at whether there are professional skills and experience in PPI amongst the core team, but whether there is anyone with direct lived experience embedded in the team as well. That's something that we sort of look out for. The steering group of stakeholders, steering group or stakeholder group for a project, again, as well as involvement of voluntary or charitable organisations that are experts in the area. We're also interested to know about how people with direct lived experience are involved in providing strategic direction or advice to the project. Co-design, particularly interested to look beyond mentions of co-designing and understand what this might mean in practice for an application. Is it co-design of a particular part of a project? Is it co-design of a project overall or something else? As a sort of a general rule, the deeper the co-design, the better. Finally, on this, the point of about dissemination, how is PPI helping inform both the strategy and the delivery, and who is it the dissemination aimed at? Find the level of detail and thought given to this in advance, the more the better. Moving on to the next point about so far and so what. I simply want to say on this point, the guidance suggests applications set out how they've engaged with developing with the research, how they've engaged with people on developing the research to date. I'd also find that if it's possible to say what difference that engagement has made, that's also something that can be useful. This takes me onto my final point here on the plans for PPI going forward. The stage 1 application forms don't include a separate section on PPI, and that's understandable. It's a shorter application. But the stage 2 application does, and the more planning for the future engagement on PPI that's done at the earliest possible stages, the better for the application. So I just finally wanted to return to one of the points that I made on previous slide about other observations on applications, and to return to a point Chris has already made as well on the equality, diversity and inclusion side. I've found that this is sort of a big issue, particularly for public members, and is often quite a major focus of our discussions and views on supporting projects. I won't delve into it deeper here, as I know that's the next presentation, and it's very pleasing to see a sort of full section on that, and I'm looking forward to hearing about that as well. I just wanted to add it here just to stress how important we see it. I think that's my main points for now. I'm going to stop there, and I'll be around for any questions or comments. Thank you.
Thanks, Fran. And it's Vipat. I just wanted to talk to the RfSC team. We have the team here, myself, Vipat, and Amy, who is doing the slides. Thank you, Amy. And we have Beth, our senior program manager, and Laura Mason, who is now in maternity leave. And obviously you have heard Ben. There was a question about how can you contact us. We have this RfSC mailbox where you can send us email. Our wonderful operation team will either respond to your queries if that is within their remit. If not, then they will delegate the email to us, and then one of us will respond to you. Most of the time we want to respond to you as soon as possible, but sometimes there are cross-team discussions, so it might take a couple of days, but we always respond to whatever queries you have. Can I have the next slide, please? Thank you. And we have also included some of the important websites in the slides that will be shared later on. So you have information about Call 6, about social care specification, and some of the other things that you might need to develop your projects. But again, as always, we we are happy to have your questions now or later on as email or any kind of communication means. I'm now going to hand over to Phoebe for the EDI part of the presentation. Thank you.
Thanks, Rufat. Can you give me a thumbs up if you can hear me okay? Fab, okay. So good morning, everyone. Fantastic to see so many people here at this RDS information session. My name is Phoebe Wallace. My pronouns are they, them, and I'm a person with white skin, short brown hair, and wearing large transparent glasses. And I'm an EDI manager at NIHR, here to talk with you today about what equality, diversity, and inclusion mean to us at the National Institute of Health and Care Research, and so what it means to you as a potential applicant to the Research for Social Care funding call. So I'll start by saying that social care research has an absolutely fundamental role to play in helping to reduce disparities that exist in how social care is delivered, who can access care, and care outcomes. And social care research is the bedrock of innovation in social care practice. Yet in the past, too often we've seen that groups who face the poorest outcomes, the most difficulty in accessing care, or the most complex needs have been underrepresented in studies, meaning that findings haven't always been applicable to these groups, and thereby potentially further entrenching health inequalities. As it says up on the slide there, RfSC is particularly interested, as we've heard, in social care research that involves underserved communities and their social care needs. And so research funded through the call is expected to have that high degree of involvement from people who draw on social care, carers, and social care practitioners. Next slide, please, Amy. So as you're considering your applications, how is EDI factored in? And to give you an idea of the NIHR's priorities as a funder with regards to EDI, on screen here are the 5 strategic themes which underpin our first EDI strategy, which was published in September. And the breadth of the themes there really reflect the fact that we are looking to tackle long-standing, systemic, and complex issues when it comes to equality, diversity, and inclusion. So not only is it about the participants that are involved in the research or the populations who benefit, but also about who is conducting the research and who decides what research is funded. All of the above needs to be evidence-led with opportunities for collaboration identified. So in terms of us as a funder, we are looking at things such as the diversity of people who sit on our selection committees. We are looking at how we can improve the talent pipeline, what we can do in terms of collaboration and partnerships. It's wide ranging, and as I say, you can have a look at our strategy online. One of our primary sources of evidence is our diversity data. So again, we do publish that online, and that gives an overview not only of the makeup of our funding committees, but also applicants and award holders. So if you do apply and you are asked for your equality monitoring information, please do provide it. This data is anonymised, and it allows us to monitor and inform our future EDI activity. And just as a summary, for us to see the step change needed in this area, as well as recognising the role we as the NIHR play, we need stakeholders from all parts of the system to be involved and take ownership. Next slide, please, Amy. So moving on then to what you as potential applicants can do to embed EDI. And first of all, I want to draw your attention to the excellent EDI toolkit from the Research Design Service. Taking various elements of the research cycle, they provide a series of prompts, case studies, useful links and resources to inform your consideration, from initial idea through to dissemination, implementation and impact. Next slide, Amy. So talking through a couple of examples briefly, And I think it's key here to recognise that we're not just talking about participants, it's throughout your whole project. So in terms of when you're building your research team, how diverse are they? If they're a largely homogenous group, are you going to miss out on different perspectives which could enrich and strengthen your research? And it's not only about diversity and representation, of course. To be able to build relationships, gain trust, and work well with diverse populations, your team will need to be culturally competent, being able to recognise when their judgments may be influenced by their own backgrounds, and understand and respect cultures different to their own. On data collection, prompts such as how equitable is your data collection strategy? So when you're collecting participant data, what characteristics are you collecting and how are your questions worded? And as you go through and consider all of these areas for multiple characteristics, you might be thinking, how am I best to structure this consideration? So next slide, Amy. And I just want to point you in the direction really of equality impact assessment. So this is a really useful tool to bring together your evidence, evaluation, analysis of impact, and action plan around equality. So that can really function as the core of your EDI plan or strategy. And there's a toolkit that's been developed by the Applied Research Collaboration Centre in the East Midlands alongside the Centre for Ethnic Health Research. And it's a really helpful guide that will take you through the necessary steps. Whilst this toolkit takes the ARC requirements for their particular funding streams as its starting point, many aspects of the toolkit are applicable across the research for social care applications. And as I say, the prompts there will help you consider how you can adapt the toolkit to your specific needs. And they've seen that people using this toolkit and implementing the EIA approach have had some of the following effects. So researchers widening their equality focus and appreciation, considering issues in their approach that they hadn't thought of before. And I think, you know, that's really key, is that you're thinking about these things right at the inception. You know, it needs to be embedded all the way through. EDI is not an afterthought that you're just going to tack on at the end. There's been early evidence of changes to trial design and to planned methods of recruitment and engagement through a better understanding of communities and appreciation of intersectionality, and consideration of issues and stigma and discrimination, to name a few. So as I say, what's really key here is that equality, diversity and inclusion, it's not just a box to be ticked. Its consideration needs to be meaningful, deliberate and iterative. And completing an equality impact assessment will really help make sure that this is the case. So as I draw to the close of this short session, I hope the key takeaways for you are that the NIHR is committed to embedding EDI throughout the health and care research system, and that you have a fundamental part to play in that. It's only through all of us pulling the levers that we have available to us that we can affect the change that is needed to make sure that we start to tackle some of those long-standing disparities in care outcomes. I've listed the resources that I've highlighted today, as well as a few more which I think will be of use. And my team's email address is on the screen. And whilst we can't advise on individual applications, we can assist with general EDI inquiries and signpost further support. So please do contact us if you need anything further. Thank you.
Thank you, Phoebe. That was great. Thanks as well to the rest of the speakers. Very informative session. We do have a few minutes for questions if anyone has any. I know there's been some in the chat. I think they've all been answered. But if somebody wants to take themselves off mute and ask a question, then they're more than welcome to. Everyone's too shy. Or maybe all the questions have been answered. Then if so, then that's fine. We'll have a short break, a 5-minute or 10-minute break. Actually, we finished slightly ahead of schedule. So we'll have a little break. And then when we come back, we'll hear from a successful applicant, and then we will hear another talk about SOCAT and CRN support that's available. And then finally, we'll hear about what the RDS can do to support your application. So we have a break and come back at 11:25. Then that would be great. I wouldn't leave. I would stay on the call. Just put yourself on mute and turn your camera off. See you soon. Who will talk us through SOCAT and CRN support that's available. Yeah, if you
hopefully. Is that working better now?
Yep, that's perfect.
Yeah, wonderful. So thank you.
Thanks, Ruth.
No worries. So I realise I've put two lovely acronyms in the title of my slide, so apologies for that. SOCAT I will come on to in a second, but CRN stands for the Clinical Research Network, and I am Ruth Hudson. I'm a Research Delivery Manager and I work for the Clinical Research Network in the east of England. So let's just address that name, shall we? Clinical Research Network. It doesn't really explain exactly what we do. So we do support health and social care research, and we support that across a wide range of settings. So I think this lovely diagram really shows you the breadth of work that we support. So it's not just the NHS. So we do support research that runs in prisons, in schools. We support research working with home care, with care homes, with community groups. And I just thought this is a really key message for the audience today. We're not just the NHS, and just please forget about the clinical bit in our name. We are here to support you. So it would be interesting to know who has actually worked with the Clinical Research Network before. I mean, I don't know if there's a way to do that, if people could just like give me a wave or something as I'm talking. It'd just be useful just to know how many people actually have worked with us before. But the Clinical Research Network, so I thought it would be helpful just to talk about our structure. So we do have a national coordinating centre which provides leadership, but we are mainly 15 different networks, and you can see the map here which just explains those different 15. I'm number 9 over in the east of England, and it's really key just and I would really advise you to just get in touch with your local network to see what support they can offer you, even now at this stage, at stage 1. So here I've just tried to summarise the support that is available to you as researchers, and we're here to support you through every stage of your project lifecycle, so we can support you to plan, place and deliver your research. So if you're on this call, you're at the planning stage, so please do get in touch and we can give you some advice and guidance. And so this could be around recruitment strategies for your project. Also, When it comes to social care, there are a lot of LCRNs with new initiatives or new projects that could really benefit you. So for example, some CRNs have got staff based in local authorities. They could be really good key contacts for you. I know that East Midlands have done a really interesting project around engagement with home care providers. So if you're looking to work in that space, it'd be really interesting to talk to them about how they've worked with those home care providers, and it could help you with your project. When it comes to stage 2, you will need us for your SOCAT validation. More on that later. And then in terms of sort of placing your study, if you need us to help you find research sites, then that is something we can support you with. And we can do that now at grant stage, or we can do that once you're funded. If you need us to help you engage with services and providers, again, that's something that we can do for you. So it's just worth having conversations just to see how we can help. And I would just say that actually our support really is tailored to the researcher and to the project. And it's really helpful just to have conversations to work out actually where we can help you best. And then when it comes to actually delivering your project, so we have experienced CRN funded staff, research nurses, research practitioners that can help identify and recruit your participants for you. However, that might not necessarily always be the best course of action. It depends on your study. So for example, we have had recently this year a study looking to invite people experiencing homelessness to take part, and actually CRN staff weren't best placed to do that, to have those conversations with those people. So actually the study team worked with homeless shelters, and they had conversations. They were inviting people to take part in the study. And actually what we could do from a CRN perspective is provide funding. So we provided funding that we call service support costs, and we provided that to those homeless shelters. And they were of course really pleased to receive that. It was a nice thing to receive for taking part and helping with that project. So let's move on. Okay, so Enrich. So I thought this would be helpful to flag. So this is a national initiative enabling research in care homes, abbreviated to Enrich. So Enrich is a network to support the delivery of care home research. So each CRM will have an Enrich lead. We also have a national Enrich coordinator as well, and she's fantastic. She has got so much experience of working with research projects in care homes. She can give you a lot of advice and guidance if you need it, as can the local Enrich leads as well. So I would really encourage you, if you're working with care homes, to get in touch and just to have conversations about how we can help. And the overarching aim of Enrich, as I've got here at the bottom of the slide, is to just help researchers to run studies effectively and collaboratively in care homes. And each CRM will have a number of care homes that have signed up to be part of the Enrich network, and we support them to take part in research however they need it. Really, it's quite a bespoke service. So just moving on, another initiative I thought would be helpful to flag today. This is particularly for anybody who wants to involve people with dementia or their carers in their research project. So Join Dementia Research is a nationwide service, and it's essentially a matchmaking service. So people who are interested in taking part in research will volunteer. They will also register with Join Dementia Research, and then they can be matched to research opportunities, local research opportunities, which means that you can find them through this service. It is free. It works really well if you want to work with carers, and it's just something you can add to your recruitment strategies. So it can be one of a number of different strategies that you use. And what I do just need to say is that the service is delivered in partnership by the NIHR and our charity partners, so Alzheimer's Scotland, Alzheimer's Research UK, and the Alzheimer's Society. Okay, let's move on. Okay, so the SOCAT. So SOCAT, so this stands for the Schedule of Events Cost Attribution Tool. And as part of the funding application process, you will need to complete one of these at stage 2. So at the moment, this is an Excel file that you can download from the NIHR website. It is going to move online, but this is a gradual process, so I'm not sure whether it will move online for you or not. There is also guidance on the NIHR website about how to complete this, how to fill this in. But what I will say is that it's really geared up for a clinical research study. So when you open this and come to fit your social care study into it, sometimes that can be a bit daunting and it can be a bit confusing. However, the good news is, as somebody who has seen a lot of social care studies and mental health studies and worked with lots of different teams to fit a study into the SOCAT, each CRN will have somebody like me. We have a lot of experience of doing this, and we are here to help you. So don't think you have to do this alone. We can help you complete this. So the purpose of this tool is to attribute the different activities that form your research study. And so you attribute each activity into one of three areas. It will be a service support cost, which is something that the CRN will fund. It could be a research cost, which is an activity that is funded from your grant, or it could be an treatment cost or intervention cost. So for example, like a support package for carers. And so that's funded in a different mechanism, which I don't have time to go into today. But let me just move on really for my kind of top tips for completing the SOCAT. So the first one is a real plea, actually. Please contact us as soon as possible. I've put 10 days notice, which would be fantastic. Like 10 days to sort out a SOCAT would be wonderful. If you don't give us that, we will try our best. We always try our best to help people to get their SOCAT completed. But if it's going to be a bit of a tricky one, the more time you can spend with us trying to work it out, the better. I'm just going to go back a section, actually, back to the first slide. If you look at the bottom of this diagram, you'll see there's different tabs along the bottom of the Excel sheet. So you've got standard of care, general activities, per participant activities. As you go further on, you've also got something called a list of activities. And the way the SOCAT works is it's basically a lot of drop-down cells, and the list of activities just gives you an overview of what is in those cells. And so that is actually really good to look at first. So when you come to complete this, have a look at that first, and you can just see what fits. So it could be that the informed consent fits. It also has things like subject questionnaire, for example. So you can just see what fits your study. The next couple of points really are just kind of how you sort of think about filling in the SOCAT. So the general activities tab, this is where you would put your one-off site level activity. So it might be that you're working with an organisation, you want them to do a mail out for you, that would go there. Or you might want them to do a database search to find participants, that would go in your general activities. With the per participant activities, this is where you're actually putting down each of, you're recording the participant's journey from that informed consent, any data collection that happens with them, any questionnaires, any interviews, you would put all that there. If you're looking at a control group, you would split them out. So you'd have participants in the control group in arm A, for example, those in the intervention group in arm B. And then there's also a tab along the Excel spreadsheet, which is called non-tariff costs. And this is fantastic for social care studies because essentially it's free text and it allows you to create activities for that drop-down list. You can label them, call them what you want. And so it really is a great way to sort of complete your SOCAT when you've got a study that doesn't maybe fit the kind of drop-down list, the things that you can pick from that. And I do know some people who just use this, they just use the non-tariff cost, they write everything in there and that's how they complete their SOCAT. And that's absolutely fine. It's just however it works best for you, really. And then finally, ask for help. It might be that your lead organisation R&D can really help you with this. If they can't, come to the CRN, have a go and come to us with your kind of first draft of your SOCAT, and we'll be able to work that through with you. So yeah, we're just really keen to help, and it's also really nice to know about projects as they're as they're in the funding stage as well for us. Okay, so finally, so these are just my final points, just things to for you to take home today. So RfSC funding is eligible for the CRN portfolio. So you would be eligible for support from our staff, and you would be eligible for service support costs if your project is funded through this call. Please contact us early for advice and guidance at stage 1. Really happy to help. Half an hour call, it could be really useful for you. And at stage 2, we provide the SOCAT validation. So you will need to contact us as well for that. So this is the end of my presentation. So I probably talked really fast. I always do. So apologies. Here, I've just put some contact details in. I will put these in the chat in a second. So there is a way to find your local study support service. And the study support service is a good first port of call into the CRN if you want to talk about a research project. So I will put that link in the chat in a second. And I've also just put my contact details here. So anybody from the east of England, if you want to talk through your project, then please do get in touch with me directly. Happy to help. So thank you very much. I'll stop sharing.
Thanks, Luke. That was great. You didn't talk too fast. It was all super informative.
Okay, good. Slick. I have a habit of talking too fast, so that's good to know.
I thought slick rather than fast. I thought you were just good. Yeah. Okay, so I think we've managed to conquer the gremlins that were stopping us sharing Anne's slides. He says, hopefully.
There was just, sorry, it's Anne here. There was just a question for Ruth before I dive in, I think.
Okay.
Yes, there was. So do you need to calculate treatment costs for stage 1 applications?
So I don't know if you need to put them in the form, do you? I'm going to look at my RDS colleagues. Or is it just a... Because you always do it at stage 2 because you're completing the SOCAT, so it comes through. Might be helpful.
Have to check. I'm not altogether certain.
Yeah, sorry. Let's sorry, I'm not able to answer your question, but certainly at stage 2, you when you complete the SOCAT, it's quite thorough actually in terms of the cost that you get. You end up with a per patient or per participant value for the excess treatment costs. But it might be worth just having a think about those with your CRN at stage 1. But I'm not sure if you actually have to physically put a figure in the form.
Rifat has a hand raised.
Yeah, thank you. So in the stage 1 form, there is this introductory box where you put your research information. So there you need to put your estimated research cost, which is your research cost. And then there is also a box that says estimated NHS support and treatment cost, where you need to put the amount. But you don't have to break down everything in the stage 1 application in the budget section, because there is no room. That is something that you need to do in the stage 2. But your actual budget for the treatment cost needs to be there in the stage 1. Thank you.
Okay, any other questions while we're fielding some? Okay, well, we'll move on to Anne, who's a successful applicant. She's got some tips on how to write a good application.
Hello, is that showing yet? Great, thank you very much, super. So yeah, we're at the stage where we're now sorting out, answering queries and sorting out contracting. So I'm really pleased to come and talk to you today. And what I thought, I was just trying to put myself in shoes of people applying, which isn't hard because we're, you know, I'm constantly trying to do this sort of thing. So I thought I would home in on, obviously give you a bit of context with a brief description of the project, and then particularly focus on collaboration and then on communicating about the project, because these were things I found myself thinking about quite a lot in the various stages of the research. We're working with care home activity providers. Some of you might know them as activity coordinators or wellbeing workers, and looking with them to facilitate public involvement in research as an activity. So public involvement in care home research often hasn't involved the people living in care homes, and that's what we're moving to do. And so we're proposing with our project to do some additional public involvement activity for some care home research in a couple of projects that are already funded, and then investigate that public involvement. That's our sort of research focus, to see if this approach with activity providers is an effective way and an enjoyable way for people to get involved in care home research. So the first point I wanted to home in on, and I'm sure you'd have been thinking about that already early this morning, is collaborating with social care practitioners. I'm based in a university myself, but it was the whole sort of thrust of our research from the start was about the research being really grounded in what's really happening at the moment in current practice. And so it was clear that we need to be in partnership with people in social care practice in its broader sense, so that we're looking at things that are relevant to them, and because this is what we want, more and more closer and more active kind of relationship between research activity and social care practice itself. So it seemed to us that it was important to try and do this collaboration from the really earliest possible stage, so that any sort of key decisions that you start to lock in as you start to think what you're focusing on or what questions you're asking are really shared decisions. And also another sort of value statement really about wanting to collaborate effectively all the way through is that, as we heard a bit from Ruth in a sense, and we know that research activity when funded can bring through some resources into the area it's happening, like in social care, but also it offers people development opportunities who are working in that field, and those can have a big ripple effect, I think. Okay, so a value sort of position, but what are the practicalities? It struck me that it's if early on when you start drafting something, I think there's always this tension between having one person who can have it in their head and sort of get drafting and get something going, versus drawing in contributions from other people, which, if you write on a piece sort of piecemeal, can take you off in several different directions. But if you can share out very early on in the process some drafting tasks, then you really will bring people's expertise and sort of perspectives in as the project begins to take shape. I think this is a common theme about allowing loads and loads of time. Now, the practicalities, we wanted the relationship that acknowledged the responsibility and the fulsome role in the research of people being co-applicants. Now, this isn't something that social care practitioners are necessarily very familiar with. They'll have similar sorts of online forms and kind of activities that they do in their work, obviously, but the infrastructure around research funding bids, you know, there's registration for co-applicants. In order to register, you have to have a CV. In order to have a CV, you have to, you know, we were kind of in a way almost thinking, oh yeah, that would be uploading a document and we can help people put a document together. But actually it wasn't quite that. It was putting things in separate boxes. And so actually this was somebody based at university and not somebody in social care in the end. The poor last person we hounded to get on it was on leave for their 30th birthday party, I think, and quickly had to get in on their phone and put some content in to allow us to actually go through the submission process. So allowing plenty of time and keeping that process moving, but also supporting people, because some people who are really expert in practice may be feeling a bit daunted or something when you start talking about putting a CV together, and may feel a bit, oh, I haven't really got much to put on there. And of course they have. It's helping people to sort of see it in that way. And of course, getting support early on to think about the costing, because this isn't, the way costing is thought about in research funding is probably slightly different to other types of project funding bids they may have gone to, although often people have got some experience of that. But each different types of organisation, and that we know there's a vast range of provider organisations in social care, will have different constraints and affordances to think about in the way they can represent and calculate their costs. So another really important aspect to me was we actually had quite a complex project that we were trying to get across, and some of the concepts which were coming from practice and really understood were actually not recognised, and research methods people who were commenting to us were not happy with. And an example of that was meaningful activity. So in our early stage peer review and review from RDS colleagues, this was really, really helpful, because people read with great thought what we were writing and were able to reflect back to us that our idea was overcomplicated, it wasn't clearly developed, and it wasn't clearly explained. We hadn't really shown our aims very clearly, and we hadn't consistently linked our aims in with what we were then saying we were going to do in the design of our research. So we took this on board, we narrowed our focus, and we simplified our design, and we tried to explain it clearly and consistently. And we were lucky enough to get invited back to stage 2, but the comments we got at that stage were still showing to us we needed more clarity And so this is the point at which in diagrams and in the words that went with them, what we intended to do in a really clear way. So this was a diagram that showed a relationship with some existing studies and how in the new proposed study there would be where we would research in three care homes for each of those three other research projects. And we then also tried to do a flow chart of the different phases in the research. And I think it's a good discipline to try and do this, and it can help you clarify your ideas, and B, communicate them. But obviously it has to fit well with the text that you're using. So really, I suppose my concluding thoughts would be it's never too early to start. Perhaps also have a scheduled series of meetings with the partners and a timeline. And more of a reflective point, really, try and stay open to comments and feedback. It can be hard because sometimes, I mean, we can all react a bit grumpily, can't we, to feedback, but equally, it's sometimes hard to get the angle that someone's coming from if they're in very different shoes to you, and you can think, oh, they just don't understand, whereas actually they're reflecting something back to you, and if you can get their perspective, then it is likely to be very helpful. But also alongside that, I would say be prepared to hold on to some key features, but be prepared to be really clear about your reasoning. And one of the things I think that I was determined to hold on to, but took a bit of work, was the co-applicant relationship. There were certain stages when I was getting feedback that it might be easier if people had a different sort of relationship with the project, but I thought it was really important to go in our project to go for that shared ownership. So thanks very much. We're currently at the stage, as I say, of responding to queries from the project management team, and hopefully we've answered them satisfactorily and moving to the contracting stage. And this is all who's involved in the project, but I would like to really thank Jean, Lisa and Annalisa from RDS for really, really helpful comments. Ruth, she's just been on, who was ever so helpful. I found that the language in that system was not speaking to me in a way, and Ruth really, really helped me to understand and interpret that. And also our colleagues back at the universities who reviewed this at various stages and helped us so much with costings. So I hope that was helpful.
Thanks, Anna, it was. Thank you. In the interest of time, we'll move straight on to Emily Beadle, who's helped co-organise this event. And Emily will tell us about how the research design service can support your application. You see a black screen at the moment, Emily. I think you're on mute. I wonder if Emily's frozen. That would be an inopportune moment if she had. Is there any questions about the two talks we've just heard?
Hi, I have a question. I'm sorry, I'm not sure how to put my hand up. I was looking for the hand up function. Am I able to ask that? Is that okay?
Absolutely.
Great. I do feel a bit shy, as you said earlier on about asking a question. It's not, applying for funding is not something I'm familiar with. I work for a local authority. We support care homes. I'm a quality improvement practitioner. We have a project in place where we've got partners on board, and I think what I'm just not quite clear of, and I'm sorry if you feel you've already explained this, in terms of understanding what can be applied for research costs and what might be deemed as service costs, in terms of the tech support that we feel that we need for this project, and also the having a coordination role, would they be considered as service costs that we'd need to find an alternative funding stream for, or might there be the potential for those to be included in the scope of this funding?
Who wants to take that one?
I guess that might be me then. So I suppose what you're talking about is something that you would consider part of your intervention. Is that what you mean, Sue?
Yeah, so yeah, I think it would be crucial to both the research and the project.
Yeah, I think sometimes it's really worth just thinking about like your research project as having an ending. And so if it's an activity that ends when your research ends, then it would be a research cost, but also sort of building into that, if it's an activity that, so should your research be fantastic and it shows that this is a really worthwhile intervention, anything that would continue if it was made standard of care would actually be a like what we would call a treatment cost or intervention cost. So you have to sort of think about the project and whether, once the research ends, and if this was rolled out, would that activity that you're talking about, so that data support, would that need to still happen after your research ends? And then you can work out whether it's a research cost coming from your grant or whether it's an intervention cost, which would need to be funded elsewhere. But I don't know where you're based in the country, but do just link in with your CRN, or you can just email me, because sometimes it's you need to know the detail of the project before you can really make those decisions. So actually having somebody in your CRN like read through your stage 1 application, have a conversation with you about how your project works, they'd be able to answer that much better than I would now, because actually sometimes it's the more information you have, it's the easier it is to answer those sorts of questions about attributing costs. But they are really tricky sometimes, and sometimes we need to ask for advice, and I sometimes ask my colleagues, I sometimes go nationally, and we try and come back with a consensus for you as to what we think it is. So hopefully that helps answer your question.
Yeah, thanks very much, Ruth. I work in Lancashire, and we do have links with the local NIHR and Enrich. And yeah, I don't want to take up time going into lots of detail, but I think there might be some scope that in order to prove the concept, we might need some additional costs to what we would expect perhaps the on cost, the onward costs would be. So I'll speak to our local team. Thanks very much.
So fingers crossed this is now actually working and my computer won't decide to do another completely unscheduled restart, which is what happened just then. So please accept my apologies for that. I don't know why it decided that that was the perfect time for that. So yeah, just to finish up very quickly, I am going to go through how the research design service can help in writing your applications for an RfSC bid. What we are, what we do, who we can help, and how you can get in touch with us. So the RDS, the Research Design Service, offers free and confidential advice on research design, application writing, public involvement to health and social care researchers across England. We have 10 regional centres across England, as Andrew mentioned earlier, and we can support social workers, clinicians, academics, and other health and social care professionals at any level. We can support in developing competitive funding applications for applied health, global health, public health, and social care research. So we can support a range of health and social care workers, including academics, as well as those in practice. And we can support new researchers as well as experienced researchers. So it doesn't matter which aspect of your research career you're at, we can definitely support you in some way. In terms of the support we can give, despite the name, we do not just offer research design assistance. We can assist with design and methodology, but we can also get involved in helping you with public involvement, community involvement, and EDI, as well as helping you to identify and helping you build a research team. One of the questions earlier on in the session was to do with being able to establish links with, for example, local authorities. That is something your local RDS would be able to help you with. We can also help you in developing your plain English summaries, which were again mentioned by our colleagues earlier, and indeed with all aspects that are involved in writing a grant application. As it's been mentioned quite so much earlier on, public involvement and EDI are fundamental aspects of any application. How we can help with those elements: we can involve public members in your research, help you link with public members and how to engage with them. We can help you with budgeting for public involvement, as well as helping you to build diverse and inclusive community engagement and collaborators to work with in your research project. Within our teams and the extended network of our teams, we have access to a wide range of expertise, including expertise in various methodologies and analyses, systematic review experts, health economics, as well as social care experts, among others. So we can help with any aspects in relation to your grant application writing. You can contact your local RDS through their website, and I will give out the links to that when we circulate the slides, and it will be on my next slide as well, which has a list of the RDS websites and the contact information for your local RDS. Do contact your local RDS as soon as possible. I know that's been reiterated, not just for us, but also for the CRN, so that you can get the help that you need when you need it. Once the request is received by the central office of your RDS, you'll be assigned to a local advisor within that region, and they will get in touch with you and collaborate and coordinate the support and input that you require for your project. This I'll circulate after the event, so this is how you can get in touch with your local RDS. There are 10, as I say, in country that you can get in contact with, so get in contact with your local one and they'll be able to facilitate support that they can give you. And this was already covered earlier by Andrew, but there is RDS events as well, and workshops such as of today's event and the grant development and writing retreat that is being held in March next year. So please do apply for that. It'll be an excellent opportunity to develop your writing grant, your grants that you're all working on. And that is everything from me, I think. Sorry, I rushed a little bit. I was very conscious of time and making sure I got through everything.
No, that was great, Emily. Thank you, and well done for managing to wrestle back control of your life from your laptop. That was good.
Yes,
you did well done. Okay, so we do have a little bit of time for questions if anyone has any. No such thing as a stupid question, just things that we don't know. Okay. Batman says that being scared is good because it gives us a chance to be brave. So if someone's a bit too scared to ask a question, do it. I'm not going to thought that. Right. Okay. Well, if anything occurs to anyone,
I think we have a hand from Alexander.
Alexander.
Hello. Can you hear me?
Yes, we can.
Yeah.
Yeah. Hello. Thanks very much for these excellent talks. I'm a palliative medicine consultant, and I have an interest in doing some research on the acceptability and the effectiveness of future care planning for care home patients, probably with a dementia focus, but possibly for all conditions. Future care planning is a concept that allows people to plan ahead for their future health and social care needs for a time when they can't express their own wishes. And it can range from anything as basic as an advanced statement of wishes, preferences, priorities, to things that are as specific as an advanced refusal of treatment. I'm just wondering what the view of your speakers and presenters today is on whether this is more of a social care research question or more of a health care research question. That's what I'm curious to know.
Who wants to take that one? Any volunteers?
I'm quite happy to say something fuzzy about it. I think you ask a really good question, and it's one of the ones that will probably be on the fuzzy boundary, and it will depend on the specifics of the application you're looking for. So I think my recommendation would be to have a clear sense of exactly what it is you want to do, and to contact the RfSC team early on to get an idea of scope. I mean, in RfSC, if there are ones that we don't think are in scope, we very often refer them to the RFPB panel. Anyways, because they're sort of fairly similar schemes in terms of their sort of scope. So it might get referred there, but I would urge you to contact the RfSC team early to get an idea of kind of remit and scope, and I guess what, some advice on to fit it into RfSC, what it would mean, and then whether that's the direction you would want to go with it.
Okay, thank you. So we did an application for the School of Social Care Research last autumn, and the feedback was it was too much of a medical intervention. Right. So I guess that exactly exemplifies the point you've made, which is what precisely aspects are you looking at? Yeah. We put a bid into the 3 schools, and we haven't had the feedback from that, although it was unsuccessful. And we were thinking of RFPB next, but I think probably the devil is in the detail of the specific intervention that's to be looked at. Thanks. I appreciate your thoughts on that.
Okay.
Any more questions? Okay. Well, that just leaves me to thank the speakers, really. It's been a really informative session from my point of view. I hope it has been for everyone else. If you're thinking about putting in an RfSC grant, read the information, all the information, then read it again. If there's anything that isn't clear, then contact the RfSC team. Start thinking about your application, contact the RDS. There's lots of support available throughout the application process, and I would strongly suggest that you use it. It's really, really useful. It's what we're here for. So keep in touch. The recordings of this presentation and the slides will be available, and as will links and things like that we've talked about. So thanks, everyone.
That's great. Thank you very much.